Okay, so hello everybody. My name is Mark Salemi. I am a veterinarian in New York City. My practice is on Staten Island. I'm born and raised in the Bronx in New York. So anybody's out there that knows the Bronx, I'm sure you do. I've always wanted to work with animals, and that was basically my dream to become a veterinarian. And Ross helped me do that. And I was one of the first students at Ross University. At that time, there was only 4 or 5 semesters before me. So I was on Dominica. I was the last class on Dominica before the school moved to St. Kitts. I moved to St. Kitts and I spent basically 2 years on St. Kitts and did my rotations and clinicals in University of Liverpool in England and for all large animals. And then when I was in Canada at University of Guelph, I did all my small animal. I did an externship at New York City's Bronx Zoo. Now it's called the New York State Conservation Society, but it's still called the Bronx Zoo because everybody knows it that way. And that's when I really learned to love exotic animals. The head veterinarian there knew the veterinarian that I worked for when I first started. So I came and worked for that veterinarian, and I've been here since for 33 years. So working with exotic animals is an exciting part of veterinary medicine because it's not only dogs and cats. And I'm not dissing dogs and cats. I'm just saying that it's something different and it gives you something to, something to look forward to. You can see anything from a mouse up to a snake up to whatever walks through that door. So I've worked on anything from mice to whales. I did research project on whales in Hawaii, and so working with animals of all different sizes and shapes keeps your interest up, I guess, and keeps you wondering what's going to walk through the door. So that's me in a nutshell, and they have a few slides or videos set up today. One's going to be on a rabbit, another one's going to be on a chinchilla, and they end up with a snake, but it doesn't have to end there. We can talk about anything in the way of small animals and exotics other than a dog and cat, because that's what's called exotics, anything other than dog and cats. So here's the first video. Hi, my name is Dr. Mark Salemi. I'm a 1987 graduate of Ross University, and today I was asked to talk about taking care of exotic animals. Dealing with dogs and cats every day is fun, but exotic animals really add more fun to your day because it's a different thing to do. There's a lot of different animals you can see when you see exotics, because basically exotics is anything other than a dog and a cat. Basically, all the things you use is the same as you use in a dog and a cat. You use a stethoscope, and then there's different speculums and different sizes of speculums that you can use. So check the animals' mouths. Other speculums you can use, something like this. And then with exotic animals like pocket pets and things like that, you measure their weight using gram scales because using a regular scale in pounds and ounces doesn't work really well. It's not as accurate. So you use a gram scale for the perch for birds and basically a container for small animals and reptiles. All right. So today we're dealing with a few different animals, and I'm going to talk to you about rabbits, maybe a chinchilla, and also some reptiles. So this is Mascara. He's our hospital pet. I take him to classes, and he's a little dwarf rabbit, and we call him Mascara because it looks like his mascara is running around his eyes. So basically what you do with rabbits, every exotic animal has different needs, and because of husbandry and diet. So you look at these rabbits, and basically what you do is when you do an examination, just like a dog and a cat, is you look at their eyes, you look at their face and make sure everything is consistent, basically symmetrical. You look at their nose, look for discharge, the eyes for discharge, and you check the ears for any kind of parasites or any kind of infection. You can check lymph nodes just like in dogs and cats, and basically it's the same kind of exam. Now, the thing about rabbits is rabbits are like little cows, all right? They depend upon eating vegetables for their diet, and they need bacteria in their intestinal tract to digest that food. Cows have a big rumen. Rabbits basically have cecums.
So cows have foregut digestion, have gut digestion, and rabbits have hindgut digestion. But they depend upon bacteria. So diet's very important. So you gotta make sure they don't eat really bad things. They need to eat things that are high in vegetable matter, but very low in carbs. Because if you give too many carbs, like bread and cereals and stuff like that, they can end up with bacterial overgrowth, and then you can have bad things that can happen. Rabbits are very prone to things called like gut stasis, where their intestinal tract stops moving. They get very gassy, and then everything swells. The intestinal tract swells, and it causes a lot of pain. They don't eat, and then it becomes a vicious cycle where they get more pain, more gas, and then they can really get sick from that, and they can succumb to it. So diet is very good. It's a very good thing. It's a very important thing to take care of with rabbits. Basically, when you listen to them, you listen to the hearts and the lungs, um, and basically make sure the heart and lungs sound okay, just like a dog and cat. But you also listen to their gut, and you should hear gut sounds. Basically, gut sounds is like when you are hungry and you hear your stomach growl. That's basically the intestinal tract moving along, and you want to hear that gut sounds in all four quadrants of their abdomen. If you do that, and they sound good, they have good weight on them, body condition score looks good, they should be fine. The different speculums you can use for different sized rabbits, and birds are things like this. So you can open their mouths. If you want to check their back teeth, sometimes you have to sedate them to put and look in the back to look at their molars. Sometimes you can put a speculum in, open it up, and look inside, and you can see what the teeth all look like. You can use a tongue depressor too. That works really well. But basically, what you want to do with rabbit is you want to examine the mouth, make sure the teeth are in good shape, and basically you want to make sure that they have good occlusion, because rabbits can also have malocclusion. There are a lot of different things rabbits can get, but that's a long video and that's a long talk that we can have. But looking at rabbits, basically you do it just like a dog or a cat. You examine all the body systems and make sure they're okay. But diet and husbandry is the most important thing with exotics, and you have to talk to the clients and educate them about that. You can have different sized rabbits. You can have a rabbit like this guy, which is mascara, as I said before, and then you can get one like this. Hold on, I'll get it for you. And then you can get one that looks like this guy, and this is Midnight. All right. So I use these guys in my hospital and for education, and I go to schools and I talk to kids from anywhere from the pre-K up through high school, and trying to educate people on how to take care of exotic animals, because that's the most important thing. If you know how to take care of them, you know the right diet and husbandry, then that's 9/10 of your battle. They get sick just like all of us, but if you take care of them correctly, you have happy rabbits. And if you have happy rabbits, you have happy clients. If you have happy clients, you're a happy veterinarian. So that's rabbits in a nutshell. Have a good day.
All right, Dr. Salemi, can you give a recap on the video?
Well, basically, the most important thing you got to take out of this whole situation is when you're dealing with exotics. I was told by the head veterinarian of the Bronx Zoo is that you should really be very good and versed in taking care of dogs and cats. And then once you take care of dogs and cats, you know how to do your diagnostics and you know how to do an exam, you can extrapolate that and use that when you're dealing with exotic animals. And the most important thing about exotic animals is that you got to know their anatomy, because every one of them is different, and their requirements for healthy life is different. The biggest thing I see with exotic animals and the biggest mistakes I see people make with exotic animals is that people do not take care of them correctly, and that means the diet and the husbandry. So if you get the diet and the husbandry under control and you do the right thing that way, usually you don't end up with problems. But if you don't do that, that's when you end up with a lot of different things. We touched on a bunch of things in there. The biggest problem I see when rabbits, the two most common things is teeth problems, where they have malocclusion, where the teeth don't line up correctly. And basically, if they don't line up correctly, the teeth can be off a little bit and they can overgrow, and then they can end up cutting the tongue, the cheek, and stuff like that. So you have to watch out for that. That's one thing we see. And the other thing we see is gut stasis. And usually gut stasis is caused by poor husbandry, or not really Well, it is husbandry, and it's a diet. And if you don't give them the right things, then what happens is the gut doesn't move very well, and then you end up with gut stasis, which can basically cause them to die. So that's very important. So examinations are basically the same as dogs and cats. You go through every system, start from the nose and work your way down. Somebody complains to you about something, like they have an ear problem, don't even start at the ear. Start from the nose, work your way down, do everything, do all these systems and check everything out. You know, the eyes, nose, heart, lungs, intestinal tract, everything, and then go to the ears because you don't want to miss anything. It's called tunnel vision. That's what we call it as veterinarians. You don't want to have tunnel vision. So you want to look at everything so you don't miss anything. And then once you do everything and find out everything's okay except for the problem, then you deal with it. So examinations are really the same in exotics. It's just that you have to tweak them for each species because each species has a different response requirements. But that's pretty much it. And for rabbits, I mean, if you do the right thing with do your homework, speak to your veterinarian that's taking care of them, and make sure that you know what you're supposed to feed your rabbit, and if you do all that, everything falls into place and you shouldn't have any problems. And find a veterinarian who does exotics on a regular basis. So the next slide or next video is going to be about chinchilla. So here we go.
We talked about rabbits a little while ago, and another rodent that we deal with, well, rabbits aren't rodents, but this is another rodent type animal, which is called a chinchilla. And this is little Missy Elliott, and she's 13 years old, and they can live up to 25 years old, these guys. They can live a long time. So they're not unlike rabbits in diet. They need a lot of vegetables, and they need hay, because they basically depend upon the bacteria in their intestinal tract again to digest their food. All right, they're really cool animals to take care of. They're not that hard. You just gotta make sure you have a nice big cage for them with water, fresh water, and they're like dust baths to keep themselves clean and basically make themselves more comfortable. Basically, if you handle them a lot, they're very, very, very docile animals, and you can live a long life with them. They can live a long life with them and have a lot of fun. Basically, with these guys, the examination is the same as a rabbit or dog or cat. Again, you got to check all the systems to make sure everything's fine. You start from the head. You look at their nose, make sure there's no discharge. You look at their eyes, and make sure that's fine too. Then you examine the ears to make sure that there's nothing going on in the ears, and you want to make sure that their body condition score is good, meaning their weight is all right. Now, again, there's different speculums you can use to look inside their mouth because you want to check the teeth, because the biggest problems you see with rabbits and rodents is overgrowth of teeth that because of malocclusion. So you can always make sure those are okay. And like I said before, there's different speculums you can use to open the mouth to look in the teeth. Sometimes you use speculum to check the molars in the back, so you can open the mouth wide so you can look in there. Tongue presses work really good too sometimes, just to get in there really quick. But you just want to make sure that everything is okay there too. Listen to the heart and lungs with the stethoscope is very good. It's a tool that you use every day, and you check for basically gut movements and things like that. The most important thing about exotics, and I can't stress it more, is that you have to make sure that the client understands that it's a responsibility to know what their husbandry is supposed to be like and the diet. Because the biggest problem I see in exotic animals is that the husbandry and diet is not taken care of correctly. And because of that, if you have poor husbandry and poor diet, if you have poor diet, you have malnutrition, vitamin deficiencies, and things like that. And then that opens them up to other things like respiratory problems and kidney disease, heart disease, just like all the other animals get and people get. All right, so basically chinchillas are a lot of fun. Weighing them, you can weigh them with a scale, gram scale, because gram scales are very good for accuracy because you can do things in small units. Ounces and pounds don't really work that well. If you can't keep them on the scale, you can always put them in a container. But most of the times, they stay pretty good. And that's pretty much it for chinchillas. Chinchillas are really furry. You see they shed like crazy. But if you comb them out and take care of them, and you can have a rodent for a long time, because most of the rodents have a very short lifespan. But these guys don't. They live a long time. So you can go from a chinchilla, like this guy, or you can have a guy like this, which is a guinea pig, and this is Chi Chi. Chi Chi is one of our 4 guinea pigs that we have in the hospital that we use for classes. Like I said before, I take care of these animals and have them as pets in the hospital because I do a lot of classes for children from anywhere from pre-K through high school, talking to them about how to take care of animals correctly, becoming a veterinarian, and being a responsible pet owner. So guinea pigs are basically the same thing I said about rabbits and chinchillas. Basically examine them, you look at their eyes, look at their nose, do all the systems, and basically all the same things I talked about before. If you do that and you talk to clients about husbandry and diet, that's the most important thing. I know I sound repetitious about husbandry and diet, but husbandry and diet is the most important thing. And that's one of the things you're going to be talking about with clients most of the time is making sure they're doing the right thing. And if you do that, everything falls into place and you have a healthy, happy animal. And you're not going to say anything today, are you? No, you're very quiet. So you have a good day, and I'll talk to you soon.
Excellent. So why is the diet so important, Dr. Salemi, with these animals?
Well, the diet is very important in these animals because every animal has a specific requirement. So like all the animals like we just showed, the rabbit, the chinchilla, the guinea pig, all of them depend upon gut digestion of vegetables, and they need the proper bacteria in their intestinal tract. So if you don't give them the right diet, that bacteria in the intestinal tract might not grow correctly, and you can have overgrowth of bad bacteria that can cause them to have problems. Every animal has different responsive requirements too. And like with the guinea pig, there's only 2 animals in the world that don't make vitamin C on their own and produce it in their body on their own. And guinea pigs are one of them, and we're the other. So they need to get vitamin C. So if they don't get vitamin C in their diet, they end up getting scurvy, just like sailors did during exploration times, and they can die from that too. So vitamin C is very important in guinea pigs. Long chain vegetable matter like hay is very important in rabbit, chinchillas, and guinea pigs. So diet is very, very important, and that's the most important thing that people should take home from this video is make sure your husbandry and diet is correct. You but basically the examinations are the same in all those animals that you saw just recently in the videos. You start from the nose, you work your way down and do all the systems, respiratory system, circulatory system, eyes, nose, ears, intestinal tract, skin, fur, do all that, and then assess the animal and approach all the problems you have one at a time. And if you do things in a concise way, you won't miss anything and you'll be fine. Most important thing about taking care of exotic animals is education. You really do a lot of education. It takes a lot of time because you have to sit and talk to the clients about taking care of them and how they should be taken care of them. So that's basically it for chinchillas. And here we go for a snake and reptiles.
We're going to switch up gears today. We talked about rabbits and rodents and chinchillas and guinea pigs, but reptiles are a big part of my practice also. So you get to see a lot of different things. This guy, his name is Nigel. He's a ball python, and if you look real close, he's really got skin that's coming off because he's in his middle of a shed right now. He decided to shed today, and I told him we were doing a video, but he didn't agree. He didn't hold off on shedding, but that's okay. So basically, when you look at snakes and reptiles, it's a little different than mammals. Is that because they're cold-blooded versus warm-blooded mammals? Basically, you want to look again, make sure the body condition score is good. He's got a good weight on him or them, and you want to check all the systems again. And the way you check the systems, you start from the nose, you work your way down. With snakes, you just basically want to make sure the eyes are nice and clear, the nostrils are clear, and when they're breathing, they're keeping their mouth closed. If you see any reptiles breathing with their mouth open or gaping, what they call, is basically not a good sign because that means they probably have a respiratory problem. Again, husbandry is very important with reptiles because every reptile is different. You have reptiles that live in the warm climates that are very humid, and then you have reptiles that live in arid and desert areas. So things like bearded dragons that live in basically areas that are pretty dry, or uromasics where they live in areas that are really dry. Those are the types of lizards. Well, you have lizards like ball pythons that live in rainforests. All right, they call them ball pythons because they like to roll up in a really tight ball, and but they're very docile snakes. They're the best. They're one of the best snakes to get if you want to have an animal that's very docile and doesn't get very big. Um, the only problem you see with ball pythons is that sometimes they're animals that go off food. They get stressed very easily. So making sure you have a proper environment for them to be hidden when they have to hide, if they want to feel better about where they are and not be stressed all the time. Because if you don't have that kind of environment, then if they're stressed, if they feel frightened, or if they feel endangered, they go off food, and then they go off food. That could be a problem because then they get very thin, and then you could have weight loss, and then they could get sick, and you can lose them from that for that reason. Um, Things you use again, you can use different types of speculums that you have, different sizes. You have big ones. And these are bird speculums, but they work really well with reptiles and snakes and lizards. They go all different sizes, different size snakes. Now, tongue depressors work really good because you can put it in their mouth and look around to see what's going on in their mouth, make sure that the mucous membranes look good and everything looks fine, and you won't hurt their teeth. When you're examining them with a tongue depressor, it's not hard to do, or a speculum. You just basically have somebody hold them for you. You can do it yourself though, but you just basically hold his head, and then you stick the speculum in, and then the mouth opens up automatically, and you can look all around pretty easily, and you won't hurt them. So speculums are a very big part of examinations for reptiles or snakes. You want to palpate the stomach, and there's the chest all the way down with your finger, and you check all the way down looking for lumps and bumps and things like that. So if you do all that and examine them straight through, right to the end, and you're feeling lumps or bumps and they look in good shape, other than the shedding that he's doing right now, he's shedding a lot, as you can see. That's what you want to make sure of. So examining a snake is basically the same as a dog and cat or any of the small mammals and pocket pets. It's just that you have to understand the anatomy and know that they have other systems that you have to check. Reptiles are a lot of fun. Just you have to make sure you keep them warm and know their husbandry really well. So Nigel's having not too bad of a day, but he wants to go back in his cage and finish his shed, so I'll let him do that. So you have a good day and see you soon. Bye.
So how many reptiles do you see or encounter in your practice, Dr. Salemi?
We probably see maybe like on 2 to 3 a day. We see a lot of lizards. We see a lot of bearded dragons because bearded dragons are the really docile lizard that likes to stay with people. You can take like a bearded dragon, stick it on your shoulder, and if it's nice and warm and sunny outside and you walk outside, they'll sit on that shoulder all day long and not move. My lizard loves to sit, with my son outside. He walks around with her, and they're very, very docile. So they're cool animals to have. But we see a lot of different things. I mean, we see lizards, we see a lot of turtles and tortoises. We see snakes, not as many as the lizards and tortoises and turtles, but we do see snakes too. So on an average day, I probably see about 2 or 3 lizards and about 6 exotics overall, in between dogs and cats. Just today, I just saw appointments this morning for about 4 hours, and I saw 2 rabbits and 3 birds, in addition to the dogs and cats. So you do see a lot of different things, and people are getting more and more exotic animals because they don't have to be walked, and they don't have to take them outside in the cold or the rain, stuff like that. So people like lizards and reptiles for that reason, and they're cool. I mean, they're good. They're cool to look at. I mean, if they're handleable, it's even better. So Ball pythons are really cool snakes to have. Just understand that you have to handle them pretty much and get them used to you being handled so that they're not stressed out, because they stress out very easily. And then they end up going off food, and that's the biggest problem with them. But tortoises and turtles and lizards, they eat no matter what you do with them, as long as you take care of them correctly. Like the other two videos before, you got to make sure the husbandry is correct. The humidity is right, the heat's right. The biggest difference between reptiles and small mammals is that mammals are warm-blooded and they make their own heat. But reptiles don't. If they get cold, their immune system drops because their metabolism drops. So if they're cold and the metabolism drops, the immune system drops, they end up with bacterial infections, upper respiratory infections. They can succumb to that. So again, educating people about the correct husbandry and diet is very important, because if you do that, you can forego any problems really, as long as you feed them the right thing. So that's the biggest thing with reptiles, is knowing each different species, where they come from. Is it moist and hot? Is it arid and hot? Things like that. And most reptiles need warm areas, because they don't do very well in cold. Matter of fact, you don't see any reptiles in cold areas, because they don't do very well. So that's the biggest thing to take home about exotics when it comes to reptiles.
Excellent.
So this is one case that we had. It was an iguana that came in, and this iguana was off food. He was in good shape weight-wise, but he was off food. He wouldn't eat, he wouldn't move around, and he was slowly getting weaker and weaker. And so the client finally decided that it was time to bring him to me. So I examined him, and he looked okay weight-wise. I mean, he might have been a little thin. He was about 6 years old at the time. And so I did my exam, started from the nose, worked my way down. Everything was going good until I got to the abdomen. When I got to the abdomen, I felt this real big round hard thing in there. I'm like, what is that? So we took an x-ray, and you can see on the left side of the slide and the right side of the slide, you can see this big white object there. So we're like, what did he eat, or what is that? And so we're looking at it and kind of couldn't figure out what it was, so we needed to go to surgery, obviously. So when we went to surgery, it was either something that would be in the intestinal tract, the stomach, or possibly maybe a bladder stone. So we did the surgery, we opened him up, and lo and behold, we found that big white thing, which is a big urolith, or a bladder stone. It's probably the largest bladder stone I've ever taken out. Now, it's hard to tell if you don't know what look at his size. He's about a 10-pound iguana. So if you look from his nose to his tail, he was probably around 5.5 feet long. From the nose to the base of his tail, is about 4 feet. So he was a big iguana, and you can see how big that stone is. Now, in perspective, you can see the stone in person. This is the actual stone, and you can see how big my hand is. And this is an iPhone, all right? So if you look at the iPhone, you see how big this stone is. So this is what we took out of him. That's the stone you see in the picture. It's starting to crack now because we took this out about 10 years ago, but that's the stone. And it's pretty much, I think, the largest stone I've ever taken out of anything. I've taken a lot of stones out of dogs and cats, no bigger than my thumb, the tip of my thumb, but never that big. So it's pretty exciting what you can find and do when you see exotic animals, and that's what I like about it, because you never know what's going to happen and what you're going to see. That's about that. Now, this last slide is, we've all been dealing with this COVID pandemic, which is very sad what's going on with people, and it's difficult to do things. My practice has been in operation since the pandemic opened. I work on the North Shore of Staten Island, and there's about 5 or 6 other hospitals on the North Shore, in addition to other hospitals on the island. But a lot of those hospitals had closed down early on in the pandemic for many reasons. Some doctors got sick, some people were scared, whatever, and their hospitals closed down. So we ended up getting very busy in my practice. Basically, I take care of one of my clients. He does parties and classes for schools called Wild Side, Party on the Wild Side, and it's a Wild Side Zoo. And he goes to places with these animals, and he teaches people educating them about how to take care of exotic animals and things like that. So we've been curbside, meaning that people come to the office, they call up on the phone, and then a technician goes outside with a mask and gloves on, takes their animal inside. We examine their animals, look what needs to be done, call the owner on the phone, and then tell them what needs to be done, do what we have to do, and then we do the procedure, and then we send the animal back outside, and the owner takes care of the fees over the phone with a credit card, and basically that's what curbside is. It makes the process a lot longer and more tedious. So between that and seeing a lot more people, it becomes very, very busy every day, and very little downtime. And the person I took care of had many animals, including exotics and reptiles, and he brought his sulcata turtle in. And if you look at that, that's a 50-pound tortoise. And I don't know what made me do this, but he was outside and he says, "I got your tortoise. I'm taking care of him." And he was out the window, and the tortoise was just sitting there. And he took a picture of me with the tortoise, and he called it the drive-through veterinarian during COVID. So it's just a little fun part of, not fun part, but making fun of what we were doing at the time, because basically we were doing curbside and almost like a drive-through. But it's been hard. We've gone through this now since March, and we're still curbside, hoping to open up pretty soon, depending upon what local VMAs and governors deem is safe to do. As soon as they let us have people back in the office, we plan on doing that again, because I like talking to people and I like interacting with people. It makes it a lot easier. So hope everybody's safe, and we'll get through this COVID thing. So basically, we're here for, I guess, questions and answers. So John's going to field the questions and throw them at me. So let's start with that.
Yes, thank you so much, Dr. Salemi. So now, guys, this is your chance to ask Dr. Salemi questions. I have a couple here, actually, that came in. Dr. Salemi, how did you get involved with exotic animals?
Well, okay, I went to when I went to Ross. When I was a kid, I liked exotic animals. I think I've had, when I was younger, when I was in high school and grammar school, I think at the height of my hobby, I had about 15 cages in my playroom, anywhere from snakes, lizards, turtles, tortoises, and fish tanks, plus the dog and cat I had in the house already. I've had chickens and I had ducks, and I liked animals, and I took care of them. My mother and my father let me do it because I took care of them. So they said, "All right, fine. If you do what you're supposed to do, and then it's okay." And that's what I did. If I wanted to purchase anything, they made me go and says, "If you want it, you got to do it yourself." So I mowed lawns, washed cars, did things on the side to do things, and that's what I did. So I always liked exotic animals. When I went to school, I thought I was going to just work with dogs and cats, because I worked as a technician with a veterinarian, and I just wanted to do dogs and cats. That's really what I wanted to do, because I just wanted to become a veterinarian. That's what veterinarians did, dogs and cats. Not so many veterinarians at that time did exotic animals. And when I was in Ross, I heard that the Bronx Zoo might take preceptors to do like an internship there. And so I applied to the Bronx Zoo because I lived not too far from the Bronx Zoo, and I used to go to the Bronx Zoo every Sunday. And so I applied. I got the externship, and when I was there, it was love at first sight. I said, "This is cool." I said, "This is what I want to do." And so, so I like dogs and cats, and I work with dog cats, but I wanted to do exotics also. So I got a job with a veterinarian who did dogs and cats, but also specialized in exotics, and that's where I went, and I've been there since. So that's how I liked, and that's how I got involved with exotics.
Excellent. So for pre-veterinary students starting out, what's the best way for them to kind of get experience with exotic animals? What would you suggest?
The best way to do it is if you can volunteer at a veterinary hospital that does exotics. Zoos will take volunteers, and you can work at zoos, like in a children's zoo or things like that of the zoo. But getting involved with a veterinarian that deals with exotics is the best way, because then you'll be seeing exotics and you'll be getting the veterinarian's view of what's going on, and you learn that way too. Um, Also, there are a lot of clubs out there. There are a lot of bird clubs and reptile clubs, and there's reptile shows that have seminars. Those are all things you can do if you're really interested in working with exotics. The best way I would say is find a veterinarian that you can volunteer for and spend time with them and basically pick their brains, because most veterinarians like that. I love teaching. I like talking to people, and if somebody comes in and say they're interested in exotics, I'm like, that's cool. Let's go for it and run with it. So that's the best advice I can give.
Excellent. So I have a clinical question here for you. You know, how do you examine larger snakes like blood pythons or more aggressive snakes?
All right. So I took care of the Staten Island Zoo for over 15 years or 10 years. I was there for 15 years, but 10 years when we were the head vets there. And we dealt with a lot of reptiles, both regular and hot reptiles. When you say hot reptiles, those are reptiles that are poisonous. So the small ones aren't hard to handle, but if they're poisonous, I recommend that you should only work with poisonous animals for like a zoo or a school or something like that, where there's antivenom readily available for each species, because each species has its own antivenom. So that's what makes it very expensive for zoos and places to keep things. So basically, to handle them, there's specific ways you can handle hot snakes with plastic tubes, where you take the plastic tube and then you stick the snake in the tube with the head, so he can't turn and get you. So then you can do the examination and do whatever you have to do. Big snakes, you might need 2 people, 3 people. I mean, the largest snake I've ever worked on was a 24-foot snake, I think it was, at the Brooklyn Children's Museum. She was a albino Burmese python, and her girth in the middle was probably, I'm trying to get in the screen, about that big. I mean, so that's about 12 inches in diameter. So if she wanted to, she could eat me, but she was docile, thank God, but she was big and strong, so you have to handle her with 2 hands and have 2 other people holding her so she doesn't get around you. But most snakes, if you have somebody else holding them, it's not so bad. But you got to hold on to the head, because they will bite. All the other snakes like pythons and boas and corn snakes and rat snakes and king snakes, all those snakes aren't poisonous. They do have teeth. They have very small teeth that they grab to pull the animal in. But they really can't hurt you, but it doesn't feel great when you get bit by them. So you want to hold on to the back of the neck so you can examine them, like I showed you in the video. Just hold the neck right behind the head, and you can examine the mouth and do whatever you need to do. So sometimes you need brute force, and sometimes you don't need, because most of them are handled at home anyway. So some of them aren't bad. But the ones that are bad, that strike out, you have to just be careful. Just like you do with a dog or a cat that's going to strike out.
Excellent. So is there any specific type of brush or comb that you use for the chinchillas?
You shouldn't have to clean brush a chinchilla out that much. They usually do it themselves, but if they get really, really heavily shedding, you should use a fine tooth comb or a brush that you can just gently pull out the clumps of hair. They will shed more. It changes the seasons in the beginning of the season, and I mean right when it's starting to get cold, they start losing their older hair, and the new hair comes in from a thick undercoat. And then in the spring, they're losing the winter coat. So those are the times you're going to see them losing and shedding a lot more. It's usually in the spring and the fall. So a fine tooth comb or fine tooth brush, and you can just take out the real loose stuff. Because if you keep on combing, it'll just keep on coming out. But it's heavier in those 2 times. So that's what you should use, a fine tooth comb or fine toothbrush at those times when you see it really shedding really bad.
Interesting. So, with us going into the fall and winter season, a question here is, how do you keep, let's see here, how do you keep reptiles safe during power outages?
During when?
During power outages, how do you keep
Oh, for
reptiles
power
safe?
outages,
Yeah.
that can be a problem. I mean, if you have reptiles and you have a power outage, then it can get a little crazy. What I would recommend doing if you do have a big collection of reptiles or fish, for that matter, if you do sustain power outages on a regular basis, you might want to think about investing in a small generator because you need to keep them warm. If your house is warm and you have a space heater that so you can't. So that's with electricity. You need space for electricity. You need space heaters. So basically, I'll go back on that. Basically, use a generator. You need a generator. That's all you can do. You can use hot water from the sink in a hot water bottle, but you have to change that very often. So having a generator available if you have a lot of reptiles is very important. Or get them next to your boiler room where it's warm. Get them as close as you can to areas that are warm in the house. If your house has gas heat, then you could put them near the radiators and stuff like that. You have to think about different ways you can do it. But generator would be the best way. I just recently had a power outage for 4 days. Thank God it was in the summertime, but if it was in the winter, I would have to turn my generator on and keep them warm that way.
Mm-hmm. So I'm going to combine two questions here for you, Dr. Salemi. One is, have you ever treated a bat or a fox? And then the second is, where did you work with whales and what did you do with them?
Okay, a bat or a fox? I worked with bats at the Bronx Zoo and at the Staten Island Zoo. Basically, we had a collection there, and that's the only thing we did there with them is that we would check them every so often to make sure they're okay and do cultures on them and stuff like that. Fox, again, at the zoo. I've never done anything. Nobody's ever brought a fox into me. Thank God, because they shouldn't be handling them. Because rabies is a very big problem, and only people who are able to take care of those type of animals should be handling those kind of animals. And are vaccinated for rabies and protected against rabies. So in the zoo setting, yes, I did. I've worked on fox and I've worked on bats. Fox are basically a small dog, no different. You do everything with fox that you do with a dog. And the bats, basically, you check. A lot of them end up with fungal problems, respiratory problems, and stuff like that. You can treat. Things like that are basically in the zoo settings. So you don't have to worry about seeing those unless you're in that kind of setting. Whales. Now, when I was at the Bronx Zoo, we used to take care. Well, the Bronx Zoo is basically there are a multitude of zoos in New York City. You have the zoo in Central Park. You have the zoo in Prospect Park. You have another zoo in Queens, I think, and there's another one in Brooklyn, and then you have the main zoo, which is in the Bronx. But they also took care of, which is part of their association, was the Coney Island Aquarium. When I came out of school in '87, the Coney Island Aquarium had dolphins and had beluga whales. So every winter or every fall, we used to have to change the beluga whales from the larger tank to other tanks if they needed any work done before the winter time. So we worked on whales there. And the dolphins we worked on because you have to check blood counts on dolphins. A lot of dolphins in captivity, even though they've always been in captivity, know nothing but captivity, have a little bit of a high stress level, and sometimes they develop stomach ulcers, and they lose blood through their intestinal tract. And basically, the only way you can tell if they have an ulcer or an active ulcer is check to see if they're anemic or not, and you have to take blood samples from them. So we would go there once a month, and you go over to the dock and tap the water with your hand, and the dolphin would come over to the dock, turn upside down, throw his fluke on the deck, and you take a blood sample, tap his fluke, and he'd swim off. and you check his blood count. If his blood count was low, then you knew he probably had a little bit of a bleed, and you'd have to give him medications for stomach ulcers like Tagamet, things like that. So working whales there. I worked with humpback whales when I was in Hawaii. Basically, one of my I met somebody on a cruise once. It was the naturalist on board, and she was doing a research project, and she was checking all the whales going from Hawaii to Alaska. And a lot of people don't realize that a lot of the whales around Hawaii and a lot of the whales around Alaska stay in those two areas. And basically, what they do is they go up to Hawaii, they go down to Hawaii in the summertime to give birth. I mean, the wintertime. Sorry, in the wintertime to give birth and nurse their calves. And in the summertime, they go up to Alaska to eat. So they go up to Alaska in the summertime. They eat, they fill up, they get fat, and they get ready. They mate up there, and then they migrate down to Hawaii, and they give birth, and then they nurse their calves, and then the following summer they go back to Alaska. And you think about that. It's pretty cool. Is that these whales go from Alaska to Hawaii in a beeline and don't miss that little island in the middle of the Pacific, which is amazing. They do that on their own. But what this research project was, they want to see what animals and how many animals made it back and forth every year. So what they would do is take a picture of their flukes and take a picture of their dorsal fins. The dorsal fins on each whale have a specific shape, and the patterns of spots on their flukes is just like a fingerprint. So every animal has a distinct identification. So you would take pictures of them up in Hawaii and take pictures of them in Alaska and see who did it. And they did it over a 3-year project, and they found that 85% of them 85 to 90% of them make it back and forth every year, which is a pretty amazing thing. So that's my experience with whales. I've been and when you go there, you take pictures of them on the water, and you go diving with them, and it was a cool experience. It really was. So that's my experience with whales.
That's pretty cool. That's pretty cool. And I have a personal question for you here. Do you own personally any exotic animals?
So in the hospital, those are all of my animals. So the 2 rabbits, the 4 guinea pigs, the chinchilla. I got 2 ferrets, 2 pigeons that were hurt, and we raised them up, and now we use them as for classes. Here in the hospital that I'm on. And then at home, I've got 3 tortoises. I got 2 Herman's tortoises and 1 marginated tortoise, and I've got a fish tank with cichlids, and I've got a bearded dragon. I can't have any dogs and cats. Oh, I also have 2 cats here also, but I can't have any dogs and cats at home because fate had it that both my children are allergic to dogs and cats, which is really strange. I've always had pets in my house, and now I can't have furries in my house. They're allergic, so I have them here instead. So I do have exotics both here and at home.
Okay. And when it comes to your clientele, how do you encourage them to come in routinely to kind of check up on their animals versus like an annual?
We try to get them in on a regular basis, basically meaning that we completely computerized in my office, so the computer generates reminders automatically. And most of my exotic people or clients are very diligent in taking care of their pets. And I'm not saying this to diss anybody or whatever you want to call it, but exotic animal owners are very, 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 very responsible, and they want to make sure everything is perfect for their animals. So they come every year routinely. After you talk to them the first time, you explain to them what they should be doing and what they should be looking for, meaning that they should weigh their animals once a month and make sure they're not losing weight. And if they see any downward trends, that means they might be sick before they show signs, and they should bring them here. So between them doing that and us giving them reminders, most of the clients do come back on a regular basis.
Okay, excellent. And we'll take a couple more questions before we end. When it comes to surgical procedures with reptiles, what are the most common procedures that you perform, and how do you go about the entry and closure of the surgery?
So the most common surgeries you do in reptiles,
Mhm.
Hmm. I would say the most common surgery I do in reptiles would be tumors and abscesses, because people, if people don't take care of them correctly, their bacterial, like I said before, if they're too cold, their metabolism drops, and when the metabolism drops, the immune system drops, and then bacteria that normally is kept in check when they're kept warm um, become opportunistic when they get cold, and you end up with abscesses on turtles' necks. You get abscesses on lizards. The other thing you get with lizards a lot of times when people haven't been to me or they haven't gotten educated correctly is they get metabolic bone disease. You see that a lot in lizards and basically iguanas and bearded dragons, where they'll get well, metabolic bone disease is that they have lack of calcium in their diet because they're not getting the vitamin D through ultraviolet light in their diet. And what happens is they need calcium for the muscles to work. And what happens is that the bones become brittle because the body needs the calcium. And the only place, if it's not getting in the diet, and not getting it through vitamin D, they have to take it from someplace. And the place they get it from is their stores. And the stores is their bones. So they take the calcium from the bones become brittle, and they get what's called pathologic fractures, where they break. So you have to treat them medically. Surgeries, you don't do as many internal organ surgeries in reptiles, like like you saw the iguana stone that we took out. We do a lot of spays in iguanas because they do get gravid with eggs that don't they call pre-ovulatory eggs that don't go down the oviducts, and they get bigger and bigger and bigger, and then the animal can't breathe because all these eggs take up their whole coelom because they don't have a diaphragm that separates their lungs from their abdomen, and what happens is the eggs take over the whole abdomen. If you go on the website nhnyc.com, you can see there's one ovarian hysterectomy on an iguana. You can see how many eggs were in this poor iguana's abdomen. So if you do make an incision, you always make the incision. It's a little different in reptiles and mammals because mammals have vessels on each side of the body that mirror each other. Basically, they go to the midline and they veer away from the midline and they go outside of the body. But in reptiles, they have major vessels. They go right down the midline. So you got to know in reptiles that you can't make an incision on the ventral midline on the abdomen, because if you do, you're going to hit a major vessel and you have a really bad bleed. So you have to stay to the side. When it comes to closing, it's basically the same way you do in mammals. You try and do a 2 or 3 layer closure. The only thing is difference on the outside is that they have scales versus we have the skin and fur. So basically you want to evert the skin so the edges meet and they can heal. So it's really not much different than dogs and cats. Just know that you have to know the anatomy. It's a little different, and you have to close them a little bit different because you want them to heal. I don't know if that answers your question.
No, I think that's excellent. That's excellent. Um, and kind of going back towards your education, a question that came in here is, what did you find was the best way to study all of the animal species, the different techniques, etc., that you have to know for exotics in vet medicine, while in undergrad and also in graduate school?
So when I went to school, there wasn't really a track for exotic medicine. When you went to school, basically, when I went to school, you basically taught certain species. You taught dogs and cats, obviously, and then all the large animal species. Horses, cattle, pigs, sheep, goats, and poultry. So those are the things you had to know. You had to know the anatomy for all those animals. So when you're in the vet school, usually you learn those anatomies because basically, if you think about it, it's companion animals and all the food animals. So I mean, that's the reason why veterinarians are around in the first place, was to take care of the food supply or the food animals. And then pet became part of the realm of a veterinarian because people had pets. But the main reason really why veterinarians came to being many years ago was to take care of the food supply and the food animals. So when I was in school, you learned about those animals, and if you want to work on birds like parakeets and cockatiels and all the different parrots, you extrapolated from poultry. And then when it came to exotics and lizards and reptiles, you had to extrapolate from the mammals, which didn't work very well. So then what we did was we went to different seminars and different things like that. And the veterinary world, when it came to exotics, was very small. So everybody spoke to each other and met with each other, and there were different clubs. You joined the Reptilian and Amphibian Society, the ADAV, the Association of Avian Veterinarians, and you went to all the meets and all the different conferences that dealt with that, and you learned. Now it's different because when you're in your senior year and your junior year, you can track towards exotics, and they have more exotics. And now there's a board certification for avian and exotic animals, so you can do that. Also, lab animal medicine comes into that too, because there is a specialty for lab animal medicine. It's basically rats and rodents and mice and stuff like that they use for testing. So when you're in school now, if you really want to do it, join clubs, and then when you get into vet school, you're going to be tracked in that direction to go if you want to do exotics, and you'll learn more that way. But you'll always learn. When I came out of school, I got involved with all the big veterinarians that wrote the books, and I called them up and I shadowed them. Anytime I had free time, I shadowed them and I learned, and I went to conferences. Dr. Heidi Hofer she was a semester behind me. She's a world-renowned exotic animal specialist, and she's a Rossi, and she does teach at school down there on St. Kitts, and for certain semesters. I think she does 2 or 3 weeks each semester. So getting involved with veterinarians who do exotics, and basically it's a love of what you want to do. And if you're interested in it, you learn and you go to conferences and you just keep on going with
Excellent.
it.
Great advice, Dr. Salemi. You're very popular. We have a lot of questions here. We'll probably last all day here, but I'll do one last question.
Okay.
Do you offer externships at your clinic?
So we don't offer externships. I don't have the time to teach that way because it's very regimented what you need to do for an externship. But I do accept people to come and volunteer. I'm usually inundated with volunteers in the summertime, and then wintertime it slows down a little bit. But I always have 1 or 2 volunteers here a day. So I always welcome volunteers because that's how I got into veterinary medicine. I volunteered and I eventually worked at an animal hospital, and so I know what it's like to have that. And I still remember those days like it was yesterday, even though it was a long time ago. So yes, I don't do externships because I don't have the capability of doing that. But I do offer that anybody who wants to volunteer, they're totally welcome to volunteer.
Excellent. And with that, Dr. Salemi, I want to say thank you so much for your time. I hope you guys enjoyed that presentation. As a reminder, you will get a recording of this webinar. So if you have any additional questions, please feel free to reach out to me. My email is here, johndnorfor@rossu.edu, as well as my phone number. If you have any questions about Ross, connecting with Dr. Salemi, or about the application process, don't hesitate to reach out to me. Thank you so much for joining, and enjoy the rest of your weekend.
Thank you. It was fun.
All right, thanks everyone.